Okay, so I'm going to do a short video on the anatomy of the heart. This heart has been cut, so it will look a little different, but I think because we've all had the lab that we should be able to identify these structures quite easily. So the first thing I want to do is I want to start off with orienting myself. So I want to know my left from my right, my top and bottom, and ventral and dorsal. So we know the base is the top of the heart, or where all the major vessels come in. So that's the base. The apex of the heart is the point of the heart. Then we have the ventral side and the dorsal side. We know that the coronary arteries and veins come across the ventral side of the heart. So that's my ventral, base, and apex. The left and the right, I know that the apex of the heart is basically the left ventricle. So that's my left. I also know my left from my right because if you stick your finger in, on the right side, your finger is going to go down a little bit further than on the left. And the reason for that is because the right side of the heart is not as strong as the left side. And the left side has a much thicker myocardium. So that's how I know my left from my right. We have the two auricles. So your auricles are the flaps that sit on top of the atria. They're there to supply give extra space to the atria and extra muscle power. So those are the auricles. Major vessels of the heart, looking at the heart at the ventral aspect, the first major vessel that you see is the pulmonary artery, and I do apologize, it has been cut here, but that's okay. You know that is the pulmonary artery, and directly behind the pulmonary artery is the aorta. We also have major vessels of veins that come into the heart, and I'm going to just flip our heart around to show you the veins. I want you to take note of the difference in the vein. So this is a vein here and an aorta and an artery. Very, very different. The veins are much thinner walled. They are darker in color, but they are much thinner walled because the veins are under lower pressure. So if I find a vein here, this is my superior and or inferior vena cava, and then my pulmonary veins come in on this side, and those dump into the left side of the heart. So now I'm going to come back across and I'm going to open the heart up and show you some of the internal structures. So I am opening up the right ventricle. Now I'm looking at the right ventricle here, and there's a couple of things that we can see. We see the endometrium, which is the shiny tissue on the inside of the heart. The myocardium is the muscle layer here. I see a valve. This valve here is our tricuspid valve, the tricuspid valve, because I'm on the right side. The cords, chordae tendineae, are what attach the valve to the heart muscle or the papillary muscles. That's the tricuspid valve. I can stick my finger up inside and I'm in the right atrium up here. This is the right ventricle. The blood leaves the right ventricle and travels up the pulmonary artery, but first